So we're going to take a look here at the reproductive anatomy of the male reproductive system. So when we look at the male reproductive system, which remembers that we're going to be combining both the urinary excretory pathway as well as the reproductive pathway. So within this, we will have the penis. In the penis, we will have the urethra. The most distal end of the penis will be the glands. We have distinct areas within the penis that we'll be taking a look at as well in a few seconds here. Within the scrotum, we will have two distinct muscles that will be involved with retraction and distension of the testicle. Connecting the testicle to the rest of the reproductive pathway is the epididymis. The epididymis will lead into the vas deferens, which will turn into the ductus deferens, or can also be referred to as the ductus deferens. The vas deferens will head superiorly, anteriorly, through the inguinal canal. It will then turn posteriorly around the urinary bladder, loop behind the ureter, and then start to head inferiorly and anteriorly again. As it does that, it will head through the ampulla of the ductus or vas deferens and start to junction into the seminal vesicles. The seminal vesicles will then lead to what's referred to as the ejaculatory duct. The ejaculatory duct will meet up with the prostate gland. The prostate gland will then allow for the junction between the two pathways, the reproductive pathway and the urinary excretory pathway. We then get to the bulbourethral gland, or was usually referred to as Cowper's gland. If we're to take a look at the penis itself in terms of its anatomical structures, we start with the root of the penis, which is anchored at the crus and the bulb of the penis to the anterior posterior aspect of the pubic bone. Coming away from the pubic symphysis is going to be the body of the penis. The body of the penis is held to the pubic symphysis by what's referred to as the suspensory ligament. Within the body of the penis, we have two distinct structures. The two distinct structures are the corpuses. We have the corpus cavernosum, which is going to be to the dorsal side of the penis, and then we have the corpus spongiosum, which is going to be to the uh, internal side of the penis. The corpus spongiosum will contain the urethra, whereas the corpus cavernosum is going to be containing the large amount of blood supply and uh, allow for what's referred to as the erection of the penis. The corpus cavernosum will be anchored at the crucis, whereas the corpus spongiosum will be anchored at the bulb. We then get to the glands, which is the most anterior region of the penis, with the opening of the external urethral orifice. If we go ahead and take and look at the penis in cross section, we have the skin or the integument wrapped around the entire body of the penis. The central pore within the penis will be the spongy urethra. In between the urethra and the skin itself, we have two layers of fascia. We have what's referred to as the superficial fascia and the deep fascia. The superficial and deep fascia will run in line with the suspensory ligament that is holding the penis to the pubic symphysis on the anterior side. To the dorsal side of the penis, we will have the large blood vessels, which will include the deep dorsal vein as well as the superficial dorsal vein. We will also have the dorsal arteries and the dorsal nerves. In between the fascia and the corpus bodies, we have a binding of taut fibrous connective tissue known as the tunica albigans. The tunica albigans will ride in line with the fascia in terms of its attachment onto the suspensory ligament. When we get blood flow into the corpus cavernosum through the central artery and into what's referred to as the venous spaces, the corpus cavernosum will start to swell. As the corpus cavernosum will start to swell, the tunica albigans will be stretched. As it stretches, it becomes taut. The tautness of the tunica albigans causes tautness onto the fascia, which causes tautness onto the suspensory ligament, which leads to the erection of the penis during psychosexual arousal. Surrounding the spongy urethra is going to be the corpus spongiosum. The corpus spongiosum is not as robust in terms of its amount of swelling during psychosexual arousal. There will be some swelling that takes place within the corpus spongiosum. However, most of the corpus spongiosum will be with smooth muscle in terms of its action, leading to peristaltic contractions within and around the spongy urethra to assist with ejaculation during psychosexual arousal.
So let's go ahead and take a look at the testicle here. When we're looking at the testicle, we have to remember is that the tissue here is going to be aerobic tissue, which means it has to have a constant state of perfusion coming through the spermatocord. Any excessive tension or what's referred to as testicular torsion on the testicle itself will lead to testicular atrophy and possible loss of the testicle itself. So let's take a look at the various structures that we have within the testicle. So the testicle itself is going to be held by the spermatocord within the connective tissue layer, which is going to include the tunicas here. So we have the tunica vaginalis and the tunica albigans. The tunica vaginalis and the tunica albigans are going to be the connective tissue that's going to surround the testicle itself. Within the testicle itself, we will have various structures working from the most superficial to the deepest structures. We're going to have the vas deferens connecting with the epididymis. The epididymis is going to be broken up into three distinct areas. We have the tail, the body, and then the head of the epididymis. The head of the epididymis is connected to the rest of the testicle via the duct of the epididymis. Connecting the ductal region of the epididymis to the testy itself is the ret testa. The ret testa is going to have the efferent ductules coming away from the seminiferous tubules within the testicle itself. The testicle itself is going to be broken up into various lobes based off of the septal connective tissue found within the testicle. This septal tissue is going to connect with the tunica albigans and is going to be housing all of the histological structures that we see within the testy itself. This is going to include the seminiferous tubules, as well as the substantial and interstitial cells. The substantial and interstitial cells are going to be responsible for protection of this spermatogonum cells. Within the interstitial cells, we also see the lytic and sertoli cells, which are going to be responsible for the production of the hormones that are coming away from the testes. The spermatogonum cells will be producing the spermatotids and the fully functional sperm, which will be found in the ejaculate. Going into and looking at the actual reproductive cells we have here, we have the sperm or the spermatocytes. In this, we have distinct regions of the sperm that we should be aware of, which include the acrosomal region, which is going to contain the digestive enzymes necessary for penetration of the corona radiata within the ovulate. The nucleus, which is going to house one half of the total complement of chromosomes for the individual. The centrioles, which are going to be necessary during the activation sequence and the fusal sequences that occur within the fertilization stages. The mitochondria, which is going to be necessary for producing the ATP required to have the sperm be motile. And then finally, the flagella of the sperm, which is going to be necessary for the sperm to go about its movement. The next set of tissue that we're going to be looking at are going to be the secretory tissues that are going to be responsible for the production of the fluids found within the semen. We'll start here with the prostate gland. The prostate gland is going to be housed within the prostatic fascia. It's made up of multiple regions within it. To the anterior side, we will see the prostatic urethra. To the posterior side, we'll see the ejaculatory ducts, which are going to be the connection point with the vas deferens and the seminiferous tubules, as well as the seminal vesicles. We have the isthmus, which is going to be the fibromuscular region of the prostate. This is going to be involved with the peristaltic contractions seen with ejaculation. We then have the colliculices and the utricle, which are going to be the areas of the prostate to the posterior side of the prostatic urethra, in between the prostatic urethra and the ejaculatory ducts. We have the prostatic sinuses, which are going to be regions of collection of prostatic secretions, which are going to be coming from the lobes of the prostate itself, whether it's the infero-posterior, the median, or the inferolateral lobes of the prostate. These are the areas that are going to be sensitive to testosterone in terms of hypertrophication and development during puberty. These are also the areas that will undergo any type of cancerous growth when we talk about prostate cancers. They're going to be producing the prostatic secretions that we see within the ejaculatory matrix. Superior and posterior to the prostate, we get the seminal vesicles. The seminal vesicles are a cluster of acinar secreting cells that junction with the vas deferens, forming what's referred to as the ejaculatory duct. The junction point between the seminal vesicles and the ejaculatory ducts are the ampullae of the vas deferens, or the ampullae of the seminal vesicles. Within the seminal vesicles, we have spherical regions. Those spherical regions are the follicles. The follicles are going to be housing all of the secretions that we see coming from the seminal vesicles that produce the semen within the ejaculatory matrix. So if we take all of these structures together, we can lump some of them into a single pathway that's going to allow for ejaculation to take place. So this is going to follow the flow of sperm through the ejaculation process. And so the ejaculation process is going to begin with engorgement of the spongy tissues, the corpus spongiosum, leading to distension and then full erection of the penis coming off of the suspensory ligament. We're going to start with movement from the epididymis through the vas deferens, from the vas deferens into the seminal vesicle. From the seminal vesicle, we're going to head into the ejaculatory duct, which is going to junction with the prostate gland. We will then move into the prostatic urethra, and then into the fibrous urethra, and then finally into the spongy urethra. As we move through there, we're going to get secondary secretions coming in from the bulbourethral gland, in particular from Cowper's gland, which is the gland that's indicated on most books as the bulbourethral gland. The Cowper's gland is going to be necessary in order to produce secretions that will neutralize any of the acidity remaining within the urethra from any urine. The hypertrophication of the prostate gland is going to ensure that we do not have release of urine during ejaculation. We will then move into the spongy urethra. From the spongy urethra, we'll move to the glans urethra, and then out through the urethral orifice.